After the age of 60, muscle strength can decline by as much as 15% per decade. For many people, this loss goes unnoticed until everyday movements, like standing up from a chair without using their hands, become difficult. This decline is not an inevitable part of aging. Research shows it can be slowed, and in many cases partially reversed, through targeted physical activity. The following sections outline why this muscle loss occurs and 5 exercises supported by clinical research for maintaining strength, balance, and mobility later in life. Beginning around age 30, the body starts to lose muscle mass gradually. After 60, this process accelerates. Researchers refer to this condition as sarcopenia, the age-related loss of skeletal muscle. Muscle tissue serves functions beyond physical strength. It stabilizes joints, supports balance, assists the heart in circulating blood efficiently, and plays a role in regulating blood sugar. As muscle mass declines, the body becomes more susceptible to weakness, fat accumulation, and reduced bone density. This is one of the primary reasons falls become more common after 60. The issue is not aging itself, but a corresponding loss of the strength needed to prevent or recover from a loss of balance. Falls carry significant consequences. A hip fracture, for example, often results in extended hospitalization, and many patients do not regain their previous level of independence afterward. Clinical research indicates that structured exercise can rebuild muscle strength and improve physical resilience, even later in life. The following 5 exercises are commonly recommended by physical therapists and aging research specialists. The squat is considered one of the most effective exercises for maintaining functional strength in older adults. Many of the body's daily movements, such as rising from a chair, standing up from a toilet, or picking an object up from the floor, rely on the same muscle groups used in a squat. When leg strength declines, these routine actions become more difficult and, in some cases, require assistance. This loss of physical independence is a significant concern for many older adults. Squats engage the quadriceps, hamstrings, and glutes, which are among the largest muscle groups in the body. Strengthening these muscles improves stability and reduces the likelihood of falls. For those new to the movement, repeatedly standing up and sitting down from a chair, around 10 times daily, provides a comparable benefit and can serve as a starting point before progressing to a standard squat. Postural changes are common with age. Reduced physical activity often leads to tightening in the chest muscles and weakening in the upper back, which can result in rounded shoulders and a forward-leaning posture. This shift in posture can compress the chest cavity, making deep breathing more difficult, and place additional strain on the neck and spine. Standing rows address this directly. Using a resistance band or light dumbbells, the exercise involves pulling the elbows back and squeezing the shoulder blades together. This strengthens the muscles of the upper back and helps counteract the forward posture associated with prolonged sitting. Improved posture has also been associated with secondary benefits, including modest improvements in mood and self-reported confidence, according to several studies on posture and psychological well-being. Falls are the leading cause of injury-related death among adults over 65. Poor balance is widely identified as the primary contributing factor. Balance is a trainable function, similar to muscle strength. It relies on coordination between the inner ear, the brain, and the muscles of the legs. Without regular use, this coordination tends to deteriorate over time. A basic balance exercise involves standing on one leg for 20 to 30 seconds, using a chair for support if needed, and then switching to the other leg. As balance improves, the exercise can be performed without support. Research in physical therapy and aging studies has shown that consistent balance training significantly reduces the risk of falls in older adults. Walking is among the most extensively studied forms of exercise for cardiovascular and cognitive health. Heart disease remains one of the leading causes of death among adults over 60, and regular brisk walking has been linked to reduced risk of heart disease, stroke, and certain types of cancer. Walking also increases blood flow to the brain, a factor associated with improved memory function and a lower risk of cognitive decline, including dementia. For cardiovascular benefit, the pace should be brisk rather than leisurely, generally defined as a pace at which conversation is still possible but breathing is noticeably elevated. Guidelines commonly recommend 30 minutes of brisk walking 5 days per week. Joint stiffness tends to increase with age as tendons and ligaments lose elasticity. This often results in difficulty with movements such as getting out of bed or reaching overhead. Regular stretching helps maintain range of motion in the joints, which can reduce pain and improve overall mobility. Stretches targeting the hamstrings, hips, shoulders, and lower back are commonly recommended, and as little as 10 minutes per day can produce measurable improvement in flexibility and comfort. Maintaining mobility supports continued participation in everyday activities, including household tasks, recreational activities, and time spent with family. Research consistently indicates that age-related physical decline is not inevitable. Individuals who maintain strength, balance, and mobility into their 70s and 80s typically do so through consistent activity rather than incidental factors. The 5 exercises outlined, squats, standing rows, single-leg balance training, brisk walking, and stretching, require no specialized equipment and can typically be completed within 20 to 30 minutes most days of the week. Together, they address the major physical risk factors associated with aging, muscle loss, postural decline, fall risk, cardiovascular health, and joint stiffness. Clinical guidance suggests that incorporating these exercises on a consistent basis can meaningfully support physical independence and overall health in later life.